for being here. This is our Navigator project. Most busy time of the year because we have open enrollment going from November 1st to January 15. However, today is a very special day because everyone to be able to have coverage starting on January 1st will need to sign up before December 15, which is tomorrow. So we are hoping to reach out to all the community members that haven't been renewed or get their insurance for 2023 to apply before tomorrow, and that's the reason for this event. I'm gonna introduce you to Chanel Tate. She's one of our navigators, and she will be doing a little summary and recap about what is enrollment event, how is the ACA works, and how can we help as an organization and as a part of the North Carolina Navigator Consortium. So thank you.
Hey y'all. So Natalie said it best. Open enrollment is our busiest time of the year, and we have done some amazing work already thus far. So just as a table of contents, basically, we'll go through a little bit of background and history of the ACA and our participation in open enrollment, some data, a client testimonial, and then what comes next / what can our community partners do to support our work. So first, open enrollment turns 10 this year, hence the balloons. The Affordable Care Act was signed in 2010, went through a bit of an uphill battle with the courts and everything like that, but the first open enrollment began in November of 2012. And the Advocacy Center has partnered with Legal Aid in the North Carolina Navigator Consortium to offer our services in Mecklenburg, Cabarrus, and Union counties. So a little bit of history. Again, in 2010, the Affordable Care Act was signed into law. 2012, the first open enrollment began. The Navigator project was then established at Legal Services of the Southern Piedmont. And then we switched from Get Covered America to North Carolina Navigator Consortium. And now here we are now with open enrollment turning 10. So this year, some major changes are helping reach more clients better, more than ever. Through the American Rescue Plan, the Inflation Reduction Act was passed, and basically it allows increased tax credits to our consumers and cost sharing reductions. And again, this is a massive benefit to consumers, whereas 4 out of 5 consumers will continue to pay less than $10 a month for their plan because of this act. So this year, at a glance, we are doing some awesome work, and we are on trend to have a better than ever year. So based on data from 2016 to 2012, we are more than likely going to double what we did before. Again, this is partially due to COVID, but we also have expanded our team and our presence in the community too. So, I mean, we are there in the community. We're at 20 different locations in Charlotte, Huntersville, Concord, Monroe. We do virtual appointments via phone and via Zoom. And then, for people who aren't in our service area, there are plenty of other options through the Navigator Consortium. So since November 1st, we have taken over 570 appointments, and that's not including the 100 plus appointments we have from the 6th to tomorrow scheduled. So 201 of those are marketplace renewals, 47 HMAP/PCAP renewals. That is a program that benefits clients who are living with HIV or AIDS. We're still doing Medicaid cases, so we have 32 emergency Medicaid clients, 44 Medicaid for infants and children, 7 adult Medicaid. So we are still doing Medicaid and marketplace during open enrollment. So again, even with our busy schedule, we are still engaging in meaningful outreach to the community. So we have had interviews with Telemundo, Progreso Hispano, and QC Life to talk about our work and broadcast it to the community. We have had 7 events, and we have targeted over 600 consumers reached at those events. Not including, we just had a very successful event at Greer Heights that we attended. We hosted events with the Ethiopian community of Charlotte, and other small nonprofits that we attended. So we have sent over 6,000 calls, texts, and emails to consumers and community partners in the last 6 weeks. That's not including the 21,000 texts that we sent via email and text blast as well. So total, that's like 27,000. And I didn't factor in the last 2 days, so it's probably close to about 30,000 emails and texts that we have sent to not only the community partners, but to consumers. So that's a lot of work. But of course, this year has not been without its challenges. We have had some changes shaping the way that this year looks. Bright Healthcare was one of the major consumer insurance policies. For people who went to Nova Health, this was the most affordable plan that they had. Typically they had $0 deductibles, $0 premiums. It was great. But unfortunately, Bright Healthcare is no longer on the marketplace for consumers for next year. And so consumers must now choose a different plan for the year 2023, and there's not a guarantee that they will have the same level of coverage in network with their doctors again this year. And then due to Bright Health's exit, consumers are receiving notices in the mail auto-enrolling them in another plan for 2023 that is not in network with their doctors. This is a major issue that we're seeing, where they're getting insurance cards, they're getting letters in the mail, and the plan that they're enrolling them in is not in network with Novant Health. So that's one issue. Another thing is that a lot of our clients are falling victim to scams and broker scams. Undocumented clients are typically easy targets because they're just arriving in the United States. They're not exactly sure of how insurance looks here, and they're not exactly sure of who to trust. So that's why the Advocacy Center is really trying to push ourselves out there to make sure consumers know that they can trust us, so they can always trust a navigator. Undocumented clients are typically not legally eligible for marketplace coverage, but there are other options, especially for our undocumented pregnant clients or clients who are experiencing major medical emergencies available to them. And then we have the option to refer them to many of our low-cost community clinic partners. And so it's sad to see these people who are falling victim to the scammers who are charging these exorbitant prices for temporary coverage. And it's just, they may end up facing legal ramifications in the future because of this. And so that's why we're really trying to push ourselves out there to make sure they know, contact a navigator first before believing every phone call, every sign on the road, things of that nature. And then the public health emergency is set to expire. Right about now, they said January 31st. They switch it up every now and then. Well, it's probably going to be extended some more. We'll see, who knows. But whenever the public health emergency ends, we're going to see terminations from Medicaid. So people who are turned over 19 during the pandemic, people who are no longer in the income brackets for Medicaid, things of that nature are going to start seeing terminations, unfortunately. And that means that Marketplace is probably going to be one of the only options available to them. And so we're going to start seeing an influx of clients because of that. And then the Medicaid gap still exists in North Carolina. So the Marketplace has also raised the threshold of the federal poverty line. So it's now, last year was $12,880. This year is $13,590 minimum to enter the Marketplace for our clients who are non-immigrants. And that means that, for some people it's just $1,000 of a difference, but that makes a difference whether they can enter the Marketplace or not. And so North Carolina is not a state where we have expanded Medicaid. And so we are seeing just a lot of people fall into this gap. Which is why we're really grateful for our community partners in our community clinics, because they can still receive medical treatment and access to healthcare through them. So this is one of my clients. I love them. They were initially told that they could not enter into the marketplace due to their income and immigration status. They were told that the only option that they had were low-cost community clinics. And coming to the United States, they were extremely well educated. They were professors in Nigeria, and they came to the United States to be closer to their children. And they had never experienced this lack of access. Again, they were professors, so they had access to healthcare and through their employer and through governmental services. So to come here and just be immediately denied was shocking to them. Someone referred them to our services, and they got in contact with me. We had several appointments, and they still call me now. But we were able to enroll them in marketplace coverage for 2022, and then we just renewed their coverage again for next year. A lot of people don't know that immigrants who have specific statuses, so it just depends on exactly what status they have, can enter the marketplace without having income. And so that's one thing that they were told that they weren't eligible for, but it's not true. So just tips and insights, again, just knowing that navigators are here to help. And then we offer assistance year round, not just during open enrollment. And then also being wary of giving out personal information. Be wary of just, following some signs on the road, phone calls, emails. And although they may seem trustworthy, they're not always. The Advocacy Center is always a trustworthy source. And so that's where we're trying to direct clients to make sure that they are contacting a federally certified navigator. And then special thanks to our partners at Charlotte Mecklenburg Library. Thank you, David. And then Atrium Health for just allowing us to be in their spaces to deliver services to the community right where they are. And then thank you to all of our community partners. We're in so many different locations this year, and all of our community partners have been just really instrumental and been an integral part in making sure that this open enrollment is a success. Caterpillar Ministries, Project 658, International House, Latin American Coalition, El Puente Hispano, the Health Department, Goodwill, Hope Community Clinic, Union County DSS, Valerie C. Woodard, Atrium House Sanger, North Park, and then our 20 trillion library locations that we are at. Independence University, West Boulevard, Matthews, North County, South County, and Steel Creek. So thank you, and if you have anybody who is in need of navigator services, here's exactly how to contact us. They can call our direct line or the national line to schedule an appointment, or the consortium line to schedule an appointment, or they can just go directly online, charlottelegaladvocacy.org/getcovered, and it'll bring you right to a link where you can schedule an appointment to meet with us. And that is all. Thanks.